This is a production of Cornell University.
I'm super excited to be here. I hope there will be some cross-pollination, and maybe there will be some opportunity for me to bridge into plant pathology and plant diseases or plant breeding. Anyway, so I'll talk about some research that we are doing in modeling of infectious diseases. I will start by just giving a brief introduction of myself, just to give you a sense of where I'm coming from. I will talk about infectious disease modeling using two approaches we have used in my lab. I'll talk about diseases you probably couldn't care less, but I will structure. I hope I will describe how methodologies could be used rather than going deep into these diseases. And I will finish with a few takeaways. So I'm a veterinarian, epidemiologist, and modeler. As a true One Health expert, I work with many different animal species and also addressing health issues through research of humans. And I've been really fortunate to be able to work at all stages of food production chain, from growing, whether animals or even plants, fresh produce, all the way to home and consumption. So that's my domain knowledge. In terms of my interests, I am really deeply interested in an intersection of food and health and how they influence each other. And then in terms of my approach, how I approach research is always thinking about three pillars. And that's what's the data, what are the models, and then what are people doing at that intersection, either as producers of data or users of tools that we develop. So infectious disease modeling is really dear topic to my heart. It's one of the earliest exposure I had to research. And I applied modeling of infectious diseases to many diseases in animals, also in people. I mentioned also modeling foodborne pathogens in fresh produce. I've never worked with plant diseases, but maybe this could trigger that. And the goal of modeling, the way we do it, is to develop a model that we could then use to forecast. So this model is like a in silico platform or a laboratory for us to study dynamics of disease, maybe forecast disease, and in safe mathematical environment with little cost, think about interventions. There are many different ways you can go about modeling, but today I will introduce just two possibly extreme ways to do it when it comes to mechanistic modeling. So a group are compartmental models. So if you think about a population, let's say people, compartmental models put individuals in this population into buckets, and then they model transition of people as groups from one bucket to another, and also interaction among buckets. Agent-based modeling takes this to a whole new level because every individual is its own bucket, and then we keep track of every individual in population as an agent, as it goes through transition, as it transitions through stages of disease or interacting with each other. So how do we do it? In mechanistic modeling, we start with everything that we understand, any data available and everything we understand about the specific disease. And then we construct, if this is a compartmental model, we construct something like this. We call this SIR model because it stands for susceptible, infectious, and recovered. Did anybody here ever seen any of this? Maybe, yes. Perfect, thank you. So what happens is, as I said earlier, we put individuals into buckets. So we implicitly assume that everybody in this population can fall into one of those three mutually exclusive buckets. Either they are susceptible, when they meet somebody who is infectious and the infection spread, they move into the infectious group. And then after some time being infectious, they stop being infectious, they recover. And they, in this specific example, they move into recovered group where we assume they no longer get infected, they infect immune. Now, there are many deviations of this type of model, and you will soon see in our own research how this can get quite complicated. So now, when we model this, so we will construct a small differential equation model right now. So we keep track of what is happening with in each of the arrows, because those are the transitions. So we have new infectious moving from susceptible to infectious bucket and newly recovered moving from infectious to recovered bucket. And you can write this as differential equations where each arrow or transition in each arrow in unit time can be described with a mathematical term. And I'll talk about each of those terms in a second. But basically, we just keep track of what comes into a bucket and what comes out of a bucket. So this term is super special for us, the term that describes new infections. And you can see that we have something going on with susceptible, the S, something going on with I, the infectious, and something that we called here beta. So basically, we are saying mechanistically, how many new infections we will see in a unit time depends on what's the pool of susceptibles. If you have more susceptibles, we could have, it's like adding more wood to fire. We could have more infection. If you have more infectious, it's like adding more oil to the fire. So we will have burning brighter. And then transmission rate is a coefficient that describes the strength of that relationship. And this transmission rate is really, really special to us. We think about it mechanistically as a product of two probabilities. One is probability that if I'm infectious and you are susceptible, what's the probability that we will meet in a unit of time? And then if we do meet, we come into the same space at the moment of time, what's the probability that this infection will spread from me to you? So first, C is probability that we will meet, and P is probability that infection will spread. By the way, this the probability of contact, the C is notoriously difficult to estimate for data. Another term here, the newly recovered. So it's about infectious individuals that are recovering at the speed of A, and this A is just inverse of the rate of recovery is inverse of the length of time in infectious period. So if infectious period lasts on average 10 days, then my speed of leaving infectious compartment is 1/10. All right, so that's how we go about it, and our models can easily become much more complicated. But the idea is that we pour everything we know about disease from all of our training and keep reading literature to thinking about these mechanistic aspects of disease spread, and then we design from bottom up, we design the model. Because we design it, we can explain to ourselves every single equation in that model. So this is definitely the model, the equations are explainable, and then we use it for our goal. This is what I call mechanistic approach. So I will spend some time now describing how we have used mechanistic models for two different diseases. And the first one is Salmonella dublin in cattle. Being here among people who are passionate about plants, I assume that you would not care much about Salmonella dublin, but it is actually quite important pathogen. It's zoonotic. It makes calves sick and also can kill them. If a cow is pregnant, it can abort. It's a foodborne disease. People don't get infected very, very often, but if they do, there is a very high likelihood of them being hospitalized because of severe disease and even dying. And on top of all that, it's a commonly antimicrobial resistant pathogen, and so it's difficult to treat. So we care about it because it's a human pathogen, it's an animal pathogen that affects animal health, and it also affects farmers' bottom line because it kills animals, and animals are not growing as well, and so it's important for farm economy. So the study was led by my PhD student at the time, Sebastian Llanos Soto. He's currently a postdoc in a bento lab here at Cornell, and the study was just recently accepted in PLOS One. So in a nutshell, we focused on Salmonella dublin in something that we call heifer raising operation. So it's about heifers. So these are young female cows or cattle, and we use heifer raising operations. These are specialized farms that are used for raising those animals from birth or from the moment they are weaned to the moment they are ready to enter a dairy herd. They will participate in production. So this typically happens just before they give birth to their first baby. So it's almost like a daycare for calves or for heifers, except they spend there like a long time. They spend there almost 2 years. And it is considered that these operations are a breeding ground for Salmonella Dublin, and I'll show you shortly why. But so basically our goal was to develop a model, so a replica, mathematical replica of one of those operations to study efficacy of control strategies, and also to see how those control strategies would impact farmers' income, the operating income. So heifer raising operations are actually quite complicated systems. So this is where domain knowledge comes in. So as I said, the farms would send their young stock to one of those operations. So multiple farms will send their weaned calves. They could also be very young calves. In this case, we modeled weaned calves, and then they are growing for about 540 days. They will become pregnant at one point, and just before they're ready to have a baby, they will go back to their farm of origin. So as you can see, mixing from many different farms, spending a lot of time together, and then going back to farms of origin. If there is infection on this herd, it will definitely have a high chance of being to spread to a dairy herd. So the model now is quite more complex than the one that I showed you in a toy example. So we have susceptible individuals that will become infected if they get infected. So, and that will be either without symptoms or with symptoms. And without symptoms, it might seem like, oh gosh, good, at least we don't have symptoms, but that's actually quite more dangerous because you have a problem, you don't even know about it. Unfortunately, some of those animals will become carriers. This means that they are no longer shedding a lot of pathogens in the feces, but they are still infectious and they can infect other members of the herd. They can also infect humans through foodborne routes, and they are notoriously difficult to detect. So when animals become carrier, so this is a stage of infection, it's really a big problem. And this is suspected as one way these animals are infecting dairy herds. So we keep track of those. And then at some point, hopefully many of those will recover. They will stay in the recovered or immune compartment for some time before they turn back to full susceptibility. Importantly, what we think, again, mechanistically, how does infection spread from one heifer to another? It could be to a small degree directly. This heifer means this heifer, they are close to each other and therefore they sniff each other and infection will spread. But most of the time it happens through contaminated environment. So feces with a lot of pathogens is being spread everywhere, and then the susceptible heifer can come in contact with this feces with pathogen next day or 3 days or 7 days later and still become infected. So the indirect transmission through contaminated environment is actually quite difficult problem to solve and also to model, because now two individuals, susceptible and infectious, no longer have to meet at the same time in space. In fact, they could meet separate in time as long as they come to the same space. So we, on top of modeling infection, we also model several intervention strategies. So right now, cleaning or scraping of floor is done maybe once a week. So we consider that as a baseline. Using skid steer, which is like a vehicle that pushes feces and then send this to manure pile. And we assume, what if we would do this more often? Would that help? How much would it help and how much would it cost? Then the other approach was alley scraper, which is like a blade that runs several times during the day on the floor of the farm and collects feces and then makes it cleaner. And then because it's automated, we assume that it could happen at different frequencies, even up to 12 times per day. And then on top of that, we wanted to see what would happen if farmer uses vaccination. Unfortunately, there's no commercially available vaccine right now. And even this one that was tested in our study was only tested in a smaller setup. And it showed that it doesn't prevent animals from getting infected. It only prevents death or reduces probability of dying. All right. So everything I said so far was about describing the system with as much detail as necessary to be able to address these outcomes. So we want to know how many animals die, how many animals will have abortion, how many carriers will be among heifers that are sent to their farm of origin, how many of them will be symptomatically infected, And then also equally importantly, what is the operating income as a difference between income that farmer makes from selling heifers minus operating cost, everything that goes into it, from feed to veterinary care to labor, and if they are also using interventions, how much would that cost? So the model everywhere put together looks something like this. So here are some results. I picked just a few just to give you a flavor. So in blue Boolean plots, I'm showing what happens in first year of prediction. We run the model for 2 years. And so for simplicity, we will just talk about first year prediction. So just focus on the blue Boolean plots. And on x-axis, I have different intervention strategies or their combinations. And the first one is the baseline, what the farmer is doing now. We want to know if they do more to stop the spread of this infection, what would that do to health, to the number of deaths on that farm. And the red line goes through the median predicted from what they're doing now. So we want to know anytime they are doing worse or better than the median of what they're doing now. So at the moment, maybe about 20 animals are dying per year. Let's see if we can do better. So if they implement vaccination, yep, they could reduce deaths almost 80%. If they clean quite frequently, they could do even better, about 80%, typically thinking about medians. So we are just comparing medians. And if they do both, they could do even slightly better, but there is some diminishing return. What about carriers? So this is another outcome we really care about, carriers, replacements going back to the farm of origin. Again, the red line shows the median predicted at the current practices, about maybe 16 animals being sent home as infected. If we do vaccination, actually we would do worse. Why? Because animals are not dying. Those that were sick were not dying, and therefore we are increasing probability for them becoming carriers. So we are actually making it slightly worse. If we are cleaning like 12 times per day, this will reduce probability of carriers almost 70%, and equally if we do both vaccination and cleaning. So if you think about carriers, vaccination is not a good strategy for farmer. What about cost? Well, it would be nice to implement all methods available, but everything costs money. So here I'm comparing no vaccination and vaccination against operating income. Again, operating income is the income from sale of animals minus everything they have to spend on. And the problem is that because this is not commercially available vaccine, we don't actually know how much the vaccine costs. And so we address this by several scenarios, assuming that vaccine costs $0 or $100 or $300 per 100 doses. How would that impact the bottom line for the farmer? Now, what you can see is that for all considered scenarios, and we consider them realistic, it will almost always, as a median, farmer would do worse with vaccination when it comes to operating income than doing nothing. So the 0 one is, for example, the farmer is not the one who pays, but maybe the farm of origin pays for the vaccine. If we do more cleaning, so this is what I have on the x-axis. So compared to no alley scraper now, but just cleaning once per week, to cleaning at different frequencies. Again, looking at different scenarios for cost, because again, we could not find good estimates for how much does it cost to do additional cleaning for every additional cleaning event. We assume some values, and quite honestly, probably it's very different costs on different farms. So in this case, depending on which strategy we would use, we would have at least a little bit of a profit. So cleaning, even with quite expensive strategies, as we consider them, would do better than doing nothing. So for this salmonella doubling, with our mathematical representation of a farm, what we found was that cleaning frequency, if we can improve cleaning, we could aid preventing the impacts, the health impacts and economic impacts on the farm. But what we really need to know is how we can estimate the cost of cleaning, and also can we clean cheaper? So this is a call for technology development. Is there a way to do cleaning quite frequently and well, but to be cheaper for the farmer? And then in terms of vaccination, it would only be preventing deaths, it would still have both health and economic impact. And basically we need better vaccines. So this was first example. The other example is very different. So shifting from cows to people. And the study was on COVID-19, specifically in food industry workers. And it was led by my postdoc at the time, Christopher Henry, who is currently at Michigan State in a teaching position. And you'll be thinking, why on earth are we still talking about COVID? Like we want to forget what happened, but really COVID, it didn't only affect our lives in school and everything. It also actually affected quite badly the food supply, and in many different ways. There were shortages of labor. People were dying, people who worked in food production environments. There was food shortage at one point. There was food waste and also animal welfare because animals couldn't be processed, slaughtered on time. And so because slaughterhouses couldn't receive them. So at the time, this was a big, big issue. And maybe COVID impacts are now almost forgotten, but we should be prepared for a new, anything similar if it happens again. So here we develop an agent-based model. So this other extreme of developing a model. And we called it find cove control. We thought it was cute. And the goal of this model was to find optimal strategies to minimize spread of infection at work while maintaining food production. So it's actually hard problem. You have to be able to maintain food production, but you also have to prevent people from getting sick. How do we do it? So here's how our agent-based model looked like. It's an agent-based model, and therefore every individual in this population, let's say a factory or slaughterhouse with 1,000 workers, every agent is modeled over time. And for every agent, we keep track of age and age-associated attributes, history in terms of infection, immunity, vaccination. We keep track of whether this is, so we have two scenarios. One was a produce farm, like vegetable farm, and the other scenario was a processing facility, like a dairy plant or slaughterhouse or a meat packing plant. Where do workers live? Is the employer providing dormitory-style housing, or are people living at home, like going back to their families? And also keep track of shifts. So the model operated on 8-hour intervals. So every 8 hours, it updated, and people were either at work or they went home to rest, or maybe they were sleeping. Depending on the model, we could have up to 2 work shifts, and there were people working in production shifts and also in cleaning shifts, which were not happening at the same time. And then also when at work, we modeled different ways for them interacting with each other, depending on what was their position at work and what is the probability for them to come into contact. And then in terms of disease, everything we knew at the time about COVID-19, with people getting infected through different ways, either by infection spread in community or at work. And then if they did get infected, they would either follow a symptomatic path where they would show some symptoms, either moderate or severe, or a path where there would be no symptoms. Nobody would ever know they are sick unless they would get tested. And also keep track of how they recovered and they were immune for some time after natural infection. Maybe they were vaccinated, or some of them even had a hybrid immunity from both. So quite complex representation of the system and also the disease. And on top of that, then we tested 13 different intervention strategies. One, doing nothing. So let's just let it run its course. And the other 12 were strategies on temperature, screening, and isolation. You remember at one point that was a big thing in food production, in actually any work environment, and also travel, viral testing and isolation, vaccination, and biosafety and biosecurity. So all of that, quite detailed, to predict these outcomes. We wanted to know how many over time are getting sick with symptoms, how many are getting sick without symptoms, how many times we have shift without enough people to work. Therefore, production cannot go as planned, and this would incur losses for the employer. How many people are not able to come at work at any given point in time? And then what are the costs of interventions? If the employer is going to pay for interventions, how much would that cost? So I'll show just a snippet of results again, just to show you what's possible with a model like this. So it's almost like a digital twin of a production environment. So sorry. Okay, so so here I'm showing two graphs. One shows symptomatic infection and the other shows labor unavailability. So people not being able to come to work. And so, in both graphs, x-axis shows days during simulation of up to 90 days. And on y-axis here, I'm showing number of people who are symptomatically sick at a given point in time, while here it's mean number of people unavailable to work. Why? Because they are sick with symptoms, therefore they cannot come to work, or they are not showing symptoms, but they were tested and found positive, and therefore they are sent home in isolation. So we identified several very tricky trade-offs. So here's the first one. And then, by the way, the different lines indicate different color lines indicate different intervention strategies. So black line is for doing nothing. It's just let the infection run its course. We'll see what happens. From symptomatic infection point of view or public health, it's the worst anybody could do because it predicts the largest number of infected people that have symptoms, and some of them possibly being severely sick. Now, from the point of view of unavailability, so people not coming to work, it's actually not that bad. So it's a really tough trade-off. If my priority is to produce food, maybe this is a better option for me. But if my priority is to protect my people, then obviously this is my priority. And so this is just one of the first trade-off that we identified. The other one comes to testing. So we tested different frequency of testing. So if testing is done, for example, every day, so those are the red lines, the red broken lines. So if I'm employer and I test my employees every day, I will pretty much curb any infection, any new infection right away. It happens, and I'll send people home. I will stop spread of infection. So I'll prevent almost all symptomatic infection. And I'll actually do pretty well because I'm reacting very quickly. I will not have many people unavailable to work. So this is this scenario. Now, what if I don't have a lot of resources and I really cannot afford testing every day? What if I'm testing once per week? Remember, like at some point we were tested once per week, even in academic environment. How would that do? Well, it's actually not doing nearly enough to prevent the spread of infection. So we still have many people who are getting sick because this isolation is not happening fast enough. And at the same time, we are isolating quite many people. And from the unavailability point of view, we are doing the worst that it can be. So another trade-off, if you are using testing, you should either do it well and do it test very frequently or not at all. Now, one example of intervention where there was no trade-off, it was kind of very clean, and that was doing very strict biosafety, biosecurity with masks and shields and ventilation, no symptomatic infections, and also no people being unavailable to work. So that's a cost-effective strategy, but we know it's not very popular. So there is a little bit of a trade-off there still. Another thing that we could do, because we have a laboratory to study infection on our computers, so we could see how outbreaks evolve. So every iteration in this model is like a little outbreak. We can see where it goes, how large it will be. So what we found was that there was quite a big of bimodality. We either predicted large outbreaks. So each of those Wallin plots shows total symptomatic infections, or and then over a number of iterations, and then this is interventions. So we either had outbreaks that were large, or very small, or none, like complete infection die-off. So we call this early stochastic die-off. It's a term that happens in real life as well. So it could be just by chance that I'm infectious, but I wasn't able to infect anybody else, and therefore, after me, there is no secondary case. Or maybe there was one secondary case, but after that, no more. So this early stochastic die-off happens, and it's actually a good thing when it does. It is just oftentimes we cannot predict it. So in real life, this is probably happening as well. And so we would either have large outbreaks or small outbreaks or no outbreaks at all. Why is this important? Well, let's say that I am employer and I say, I read somewhere that if people come to work with two left shoes, then that's a very good strategy to prevent spread of infection. It's completely silly, right? But let's try it. And so I implement this in my facility, and there is no infection. And therefore, on sample size of 1, I decide, well, look, it worked, right? It could have been, and in fact, if that happened, it would be early stochastic die-off. The reality is that we cannot know, we cannot go back in time and say, was it an early die-off or not? Does that make sense? Okay, so what did we find? So we were able to test quite a large number of interventions and learn how some are more cost-effective than other. We also, I think, are now better prepared for similar pandemic in the future, including the bimodality in outcomes and the early stochastic die-off and how that can impact design of control strategies, or even policies that are based on anecdotal data, rather than, like, it would be better to have a model like this used to design control strategies than just rely on sample size of 1 that might have happened. And then the other big thing, we revealed the trade-offs, like that somebody has to choose between protecting workers and supplying country with food. This we didn't solve with this study, but we at least started the conversation. So this is what we have been doing until now. This is our bread and butter. We develop these kind of models all the time for different diseases. Right now, we are, for example, developing one for bird flu in cows. Maybe you've heard of that. So we are working on that. So what can we do something differently? So I was really fortunate to be able to work with really amazing people, including Jennifer Sand here at Cornell, and 2 previously undergraduate students and now following their own careers. So they introduced me to something that's called symbolic regression. So it's an AI method where, rather than handcrafting equations from bottom up, like we have been doing for years, you have AI discover the model for you. So symbolic regression is like, it's part of a foundational AI that mirrors human reasoning through symbols and logic. So how does it work? We tested 2 strategies. One is PySR, genetic programming, and the other one is equation learning. And I want to run this short video to show how genetic programming runs. So it's truly like evolving the right model by trying different things through the data. And so if this red line, I don't know if you can see it, red line is the truth, you want to find, identify, discover equation that will make the black line match your red line. So that's what behind the scenes these models are doing. So this is genetic programming, and the equation learning is a little different approach where you start with predefined terms. So you say, okay, we can have term for infection transmission, we can have term for recovery, we can have term for vaccination. So you kind of tell the model what kind of terms you want to see. So here is a description of the 2 approaches side by side. I will not go through that. I will instead show you some of the exciting results, what we can do. First of all, there is no data to run these models. I mean, I do not have data. Maybe in plant pathology, there are enough data, like sensor data, to run these models. So in my world, data are so expensive, and those that exist are in silos. People are afraid to show them. So what we did, we used synthetic data. We created true data, truth, using our agent-based models. And then we aggregated outputs of our agent-based model to mimic what we might see in reality. And so we aggregated to something that looks like this if we would use an ordinary differential equation model. And then want to see, okay, so if we know how the dynamics of infection should look like, if we then use one of those two pipelines, AI pipelines, to discover the model for us, how would that look like? So first check is, how do the lines look? So the colored lines are the trajectories from our truth model, so from our model. So this is the truth. And the dotted lines are integrals from the discovered models, for discovered equations. And so for equation learning, that's not doing terribly well, but still pretty good, considering we didn't have to do anything except run the code. And then for PySR, actually pretty good. So there is good alignment, good promise. What about explainability? Because the point of doing modeling mechanistically is that we understand exactly what each of the terms means. And then we interpret and use that to design control strategies. So this is maybe a little bit small, but for equation learning, the discovered model was pretty similar to what we would have expected. For PySR, many terms. This is why it fits so well. But some of the terms would have very small coefficients, so we shouldn't worry about that. So overall, still pretty good, promising. How can we use this? Like, is there some, other than us just using symbolic regression to replace us, can we use this methodology for something useful? So here's an example. Because I said data are super expensive to collect, what if we ask these methodologies, how often should I collect the data to have enough? Because I cannot have data every minute. I cannot probably have every day. What if I have every 3 days, 10 days? So using our synthetic truth data, we took samples from that data, pretending that we are sampling every second day or every 3 days or once per week or once in 10 days, all the way up to monthly. And then we use that sparse data, like much less data than like something that would be closer to reality, to see whether those pipelines were able to discover the right model. And we measured error using mean square error. So as you can see, all the way up to frequency of sampling every 10 days was actually pretty good. So we could use a model like this to tell us how frequent should our data collection be, for example. I got a sign that I should hurry up, so I will not show you one other use of symbolic regression. I will just maybe add one more point, and that's because I've been talking about data. Another part of my world is qualitative research, where in this case, we wanted to know what prevents people from sharing their data. And in this specific case is about food safety data, because food safety data is quite sensitive. And this is led by Linda, who is actually in the audience, and a few other people. And I will keep it really short. I'll just say that overall, people were very excited about the prospect of sharing data. So this was not something that they're actually against. But there are many technical barriers, including the lack of standardization in data. And the one huge barrier that we discovered was trust. So the people not trusting their peers, not trusting consumers, whether they will understand the food safety data, and not understanding government. What if government gets their hands on this data? So I will use that to finish. So infectious disease modeling is super exciting to me. I think maybe one of the reasons is that because it's typically happening, there's some sense of urgency, like we have to find this out very quickly. There is a lot of uncertainty, so you really have to power up your brain, like what does it mean, and what are all possible biases, or what could it mean? And there is limited data availability. So it's like a really hard problem to solve. Mechanistic models have been doing really well, like for decades, even in my own career, we have been using them quite successfully, but they are really labor intensive. And the amount of knowledge that you need to be able to construct that model, both to be trained, to become trained, but then also for every new problem to develop a model, it takes a long time. So I'm really excited about AI and whether AI can now help us. I do think that AI it will not replace us because human in the loop is still necessary. I mean, there has to be people like us who are then checking the output of AI and saying, yeah, this makes sense, or no, this is complete rubbish. And I will finish with call for obviously more data and also data governance to address the trust issue about data sharing. And then the final point, I think we need improved AI literacy for people in domain with domain expertise. People like me, people like in my lab, for us to be trained at this intersection with AI, to be able to train better AI for our very practical uses. And many thanks and questions. Yes.
I was just curious, how generalizable are like the models that you guys constructed for Salmonella or the COVID? Like depending on if it's serotype or a COVID variant, are they still applicable?
That's a great question. So question is how generalizable are models that we develop? Sometimes they are very generalizable. The simpler they are, the more generalizable they are. If models that are quite, that have many layers of information coded, they will obviously not be as generalizable. For example, different strain, it will be generalizable. There are just few parameters that will need to be parameterized, but it would not be generalizable in a sense that, oh, let's just apply this model now to a school environment or a police station or a post office. Like, so there's, but it could be maybe applied to an animal farm. This is not what we have done so far. So if parameters, there is some architecture that could be easily adjusted, and also parameters, if they could be easily adjusted, then they are generalizable. If not, then it's a digital twin of that specific environment. And in fact, that's how we envisioned for the COVID model specifically. We didn't envision it as much as a tool that represents the whole US industry. There were parameters in the model that where the user, let's say manager, or in this facility could adapt the model to their own specific environment. So they could get recommendations based on their own environment. Great question, thank you. Yes.
About your whole model in the sending home the cows. And you were saying how like if you vaccinate, it actually makes it so that you end up having to send home more cows. I was wondering like if there's less of a need to send home cow, like if there's like in your model, are you taking into account that like it even like if the cows are asymptomatic, if like there's a large number of asymptomatic cows, but it doesn't matter because almost no cows become symptomatic, so you're not having any abortions or anything else like spontaneous abortions or dead cows, like does it matter? Like do you need to send those asymptomatic cows home?
Oh, okay. I think if I understand your question, so the problem is that we would not know. Like, so the farmer doesn't know. Like, heifer raising operation, I'm done. Look at them, they look healthy. And they enter the farm. If their farm is not doing a good job with quarantining and stuff, or even testing, these are really hard to diagnose, especially carriers. Like, you have to repeatedly test, and then only maybe you detect. And then by then, it might be already too late. You have the infection in the herd, in the dairy herd.
Send the cows home in the first place.
So in our model, we know the truth, right? So because it's a model. So so in our model, we know the truth. And we know that this is happening because dairy farms do have outbreaks after introduction from heifer raising operation. But to have a longitudinal study to collect information would be really expensive. You would have to have many herds and many cows tested with a test that is really bad. Yeah, there was another hand. Yes.
Okay, I have a follow-up question. So you really didn't test the asymptomatic groups in your compartmental model, right? So I mean, how did you define an asymptomatic group in your compartmental model? First question. And how did you keep track of these asymptomatic groups.
Mhm.
In a course of experiment, which was 2 years, right? I mean, if the definition of asymptomatic is not correct, and if the track method is not right, in the end, the outcome is kind of not correct because it's biased toward the way how you define asymptomatic and how did you keep track of asymptomatic groups.
Okay, so I'm not sure. So let me see if I understood. So you are worried that we are not testing or keeping track of asymptomatic animals. It's a mathematical model, so we keep track of everything.
Yes, but in reality,
Oh, in reality, so that's the problem. So here's a heifer raising operation. They want to make sure they earn money. And they lose money anytime when a cow aborts, a heifer aborts, or if they lose a calf because of this infection. So they lose money. But after nearly 600 days, they want to ship raised heifers back to their farm of origin. Now, there could be some stipulation you have to test before or test after arrival, but that's hard because it's really hard to diagnose. This is a really hard to diagnose problem. So the solution is to have better control at heifer raising operations, so the probability of sending infected animals to a dairy farm would be smaller. Does that make sense?
yes.
And we know, like, how does infection even get into heifer raising operation in the first place? From those dairy farms, because their calves are born to infected moms, and then they're shipped to this daycare. One of those will have to be infected, or else this infection, it's a cow-adapted pathogen, so it will have to come from cows. Does that make sense? But good question, thank you.
Let's thank Dr. Ivanek for the nice talk.
Yes.
Here for some time.
Yeah, I can stay a little bit, yeah.
If you have any questions,
Yep.
feel free to come over.
And if you have plant pathology data you want to model, yay, please let us know.
This has been a production of Cornell University, on the web at cornell.edu.